Thank you for tuning in. Do you like my hair? I know you like it. So today I want to go to the hospital for a checkup. Yeah, there's nothing wrong with me. I'm fine, thank you for asking. But I'm getting certain symptoms that I actually want to go have checked out at the hospital. Yes. So before I do that, let me quickly share my experience that I had with you guys so that you know why I actually want to run and go have this thing checked out. Now, back in 2019, January to be precise, I had a surgery. I had a case of ovarian cyst. So I had a surgery to take it out. Yeah, I know. Now, here is the thing. I feel like if I had checked it out on time, it wouldn't have gotten to the extent that I would have to do a surgery to take it out. I had indications, okay, I had symptoms. Will I say just one symptom? Of all the symptoms of ovarian cyst, I only experienced one symptom, and that is pain in the lower part of my left abdomen. Yes, ovarian cyst is usually being caused mostly by hormonal imbalance. So if someone is experiencing hormonal imbalance, it's likely that the person will be checked out for signs of ovarian cyst. Yes. Now, in my own case, I wasn't having hormonal imbalance. Okay, my flow was frequent. All right. The only thing that people know is usually the signs of hormonal imbalance is when your flow doesn't come as frequent as possible. Now, mine was frequent, my darling. It was frequent. And the only thing that was pointing me to that direction, which wasn't even really enough, was just the pain in the lower part of my left abdomen. Yes. Know that I started having this pain when I was a teenager, in my teenage years, and I wasn't really informed. I didn't know much about ovarian cyst, or I didn't even have an idea there was something called ovarian cyst back then. So the pain was there. It was reoccurrent, all right? But here's the thing, I thought they were hunger packs, because whenever they came and I munched on something, I felt relief. You get? So I was not thinking, okay, this thing is hunger packs. Since it's my stomach, it was hunger packs, and I usually do skip meals quite a lot. So I felt those were my body telling me, okay, auntie, you need to eat. Now the pain continued for like years, and then after I left to study, I wasn't feeling the pain for like a whole year. After like a year, I had the pain. Now here is the thing, the pain became more intense than how it was. The pain became so severe that painkillers were not helping me, to be honest. And bear in mind that the painkillers I was taking, they were not tablets. They were giving me shots like every 2 hours. I had shots every 2 hours. Shots. It was intramuscular pain relief medication that they were giving me. These painkillers they were not able to help me with my pain. It was that bad. It was so bad. Like, it was a traumatic experience that I was so much in pain that to the extent that the only thing that was going on in my mind was just to take a knife, like rip that place open and just yank the thing off, anything at all, just to stop the pain. Now, when I got to the hospital and they ran a test on me, like they ran a scan, they said that the cyst was so big. They said I should do an MRI scan just to be sure that it wasn't cancerous. Yes. And as God may have it, God being faithful, it wasn't. Now, when I had that surgery, it was a laparoscopic surgery, by the way. Now, laparoscopy is minimal invasive surgery. That laparoscopy is usually used for surgeries that have to do with the pelvis or the abdomen, all right? Now, doing that, what they do is they make tiny incisions, maybe 1, 2, or 3 incisions. Now, they will use the laparoscope, which is a tube, a thin tube. It's a telescope. Now, at the end of that tube, it has a camera attached to it and also a light. Now, they will insert that through one of the incisions that is being made on the person, and then through the camera and the lights, they will pick up the image of your internal organs, your inside, and that telescope is being connected to a monitor. Then the surgeon can actually look at the monitor and see what they are doing. So they don't have to cut you open from end to end, no. They just make that small incision, pass that through, and then with the camera attached to that, they can see what's inside. And they'll be looking at the monitor while they perform the surgery on you. And then they will have to make an extra 2 or 3 more incisions to pass the surgical equipment through into your body, so that way they will see, they can cut whatever it is that they have to cut and bring it out. Now this laparoscopy is being used for surgeries like ovarian cysts, like I said, surgeries that has to do with the abdominal, your abdomens and your pelvis. And not just that alone, they also use laparoscopy to check, do further inquiry. Maybe they did a scan, they weren't so sure, they wanted to actually pinpoint down what is wrong with you in these areas, in your pelvis and your abdomen. And again, they use laparoscopy too for when they want to do tissue biopsy. They want to cut out a sample of the tissue to test it for what is actually wrong with that particular part of your body. They use laparoscopy to do all of these things. The incisions are so tiny, the scars are minimal, and they heal very, very fast. It's very effective. Now, the person that ran that surgery on me was in the hospital, she was the chief gynecologist. Now, she told me that in all her years of practicing as a gynecologist, that she has never seen a cyst as big as mine. And here is the thing had a torsion. Now, a torsion means that the cyst was twisted at one end. That was why I was feeling that so much pain. I was in that so much pain. That's what she said. So after that surgery, I have been so intentional about my health. Any little thing, any small thing, I will run to go to hospital, because I feel that if I've actually checked out that thing earlier, I wouldn't have had surgery. See, that entire experience gave me PTSD, to be honest. So what I'm saying is, please don't ignore symptoms. Trust me, it's better I do hear a lot of people, they say, why would they go to hospital? That whenever you go to hospitals, you see what you're looking for. I don't understand. It's better to know. So I'll see you guys later. I decided to go straight to the lab. I run a test, then take the results to go see a doctor. And before I came to this lab, I actually googled about these people to know what their services are like. And to be honest, I saw good reviews about them online. And these people, they actually lived up to my expectation. Okay, I love the fact that the environment is very calm and cool. It's far away from the main road, and that's very good. I really, really enjoyed my stay here. I had to fill this form, and after which I was made to wait for a little while because the sonographer was actually busy with another patient. The guy at the front desk was actually very nice and friendly. Like all the people I met at this lab, they were warm and welcoming. I was made to drink 7 cups of water. The sonographer said it was very important that my bladder is full so that the scan can pick up a good and clearer image of my insides. So at the lab, they did an ultrasound scan for my pelvic and abdominal region. They equally ran a test on my liver, they checked my lungs, they checked my bladder and my spleen. Okay, and I'm going to do more tests. I know it's extra, but I want to know everything. I just want to know the condition of my body. I want to know the condition of my health. I'm so curious to know, because it's actually ignorance that kills. All right, if you know what the problem is, you know exactly what to do. And the test came out, and I know exactly what to do. See, let's talk about ovarian cyst. In the earlier part of this video, I talked about pain being one of the symptoms of ovarian cyst, but it's not the only symptoms. It's just that it's mostly pain that I felt during my own time back then. In addition to the pain, okay, hormonal imbalance is also one of the indicators. If your period is not frequent, or if your flow is heavier or lighter than usual, you need to go check yourself out. And then again, if you're spotting a lot, and I understand spotting is common during ovulation, but if you find yourself spotting a lot in between your cycles, you need to go check yourself out. Yes, in most cases the pain is even the last thing you might feel, just that in my own case it's only the pain that I felt. Our body system differs, and that's understandable, so please go run your test. Don't just wait, and when you feel something that you don't understand, you cannot explain, please speak to your doctor about it. And they don't even say I'm a man. Even if you're a man and you come across this video, you can share this information with the women in your life, with the ladies in your friend circle. Even as a man, you need to go check out yourself. There are certain things that men should keep an eye out for, like prostate cancer. Yes, it's usually predominant in men 40 years and above. Get that checked out. And even if you're not up to 40 years old, there are other things you can check out for. You can check your blood sugar level, all right? You can also check your blood pressure. This applies to both male and female. Check out your sugar level. Keep an eye out for your blood pressure, all right? Even as a woman, it's important to know your fertility profile. Yes, check your hormones, especially if you're trying for a child, or you're looking to get married, or you're already married. It doesn't matter. Check your fertility profile, check your hormones, all right? Check your ovaries, your eggs, even your uterine. When you notice things that you don't understand, please make an appointment with your doctor. Don't just wait or sit out there and just assume. Don't do that. It's better to know than to die in ignorance. Trust me. If a lot of people do run their checks at least once a year, okay, a lot of medical conditions, a lot of sicknesses would have been prevented, to be honest. Because if you're able to detect this thing while they are at their early state, a lot can be done. I just said, let me bring this information to you guys. Like, check your body, and if you already have an underlying medical condition, please check, because all these things, they can actually be a pointers to something else. Let's say if you have high blood pressure, you can easily have heart attack, all right? You can have a cardiac arrest, and if your blood sugar is high, it can even spike up your blood pressure. So please check all these things. Check your mental health as well. Check your eyes, check your teeth. Please do all these things for yourself, okay? It's for your own good. To be honest, you doing all these checkups is one way of you showing yourself some love. So please show yourself some love, okay? So I just let me bring this to you guys notice. All right, so thank you guys for tuning with me on today's video. I'll see you in my next video. Bye.